And I've got to say, when we see patients taking Fortify Focus, I am seeing patients that have reduced subjective symptomology for many conditions, but mostly associated with the computers. I mean, let's face it, we're all living in a digital world these days, and we're all having an accommodative stress factor that's much higher than it was when I grew up. What I'm seeing in clinical practice, when patients take Fortify Focus, not only do they seem to have less dry eye symptomology, but they definitely have less eye fatigue. Neck hurts, vision fluctuates, eyes feel sandy, gritty, burn, tear, itch. A lot of these symptoms decrease dramatically and some resolve completely. Hey, I'm Dr. Michael Lange. We want to age as gracefully as possible, don't we? So is there enough evidence out there that proves that certain specific nutrients, ingredients, or supplements can enhance our skin, our joints, our hair, our nails? And there's a lot of great science that's come out recently with marine collagen tripeptides, riceramides, hyaluronic acid, and there's a new supplement called Dermaval. Well, we've taken all four of those and we've combined it in a supplement called Rejuvenate. 3 delicious flavors.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortify Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 813-282-8283. That's 813-282-8283. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor, or Ask the Doctors this morning. I'm Dr. Michael Lange of the Lange Eye Institute and Fortify Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, or a nutritionally related topic. So don't be shy. Pick up the phones and give me a call. I should say give us a call. My co-host is Dr. Susan Summerton, who also hails from the Lange Eye Institute and Fortify Vitamins. And I got to tell you, this is the last show of the year. So this is our farewell to 2025 and welcome to 2026. Good morning, Dr. Summerton. Can you believe that it's almost 2026? Oh, we're waiting to see if she is calling back. All right, so it is almost 2026. We lost Dr. Summerton, but we're going to get her back here in just a second. So we got a big show planned today, and we got a lot to talk about. If you've got a question, give me a call at 813-282-8283. That is 813-282-8283. Remember, this is the last show of the year. So no matter how simple or complicated your question is, as long as it's an eye care related question, I'll be happy to address it. And Dr. Summerton will be happy to address it as well if she is on the line. Let's try to retrieve her again. Dr. Summerton, are you back?
Good morning. I'm back. Wishing everybody a happy new year. And we're so excited. I missed what you did say, but I know that we are going to talk about some great New Year's resolutions. And we're here to help and look forward to the callers the last of this year.
Can you believe it's 2026, just in a few more days? Where did 2025 go? I mean, Dr. Summerton, it was just the other day. We were doing the Welcome to 2025 show.
I know. It looks like everybody said time goes fast. So we do need to make the most of it. Start making those small changes that you want in your life, because before you know it, the year will be over.
That's absolutely correct. And today we're going to talk about ways. We're going to talk about kind of like some New Year's resolutions. We're going to talk about ways to help you live longer and be healthier, how to lose fat and build muscle, and if you want to thrive and not just survive. So those will be some of the topics we're going to talk about. But first off, I just want to, like I said, wish everybody a very happy and healthy 2026. 2025 is almost over. We had a great year at the Lange Eye Institute, a great year at Fortify Vitamins. I want to thank all of our listeners and all of our viewers from all over the world for making Ask the Doctor one of the most popular live syndicated medical talk shows in the country. It has actually the longest running live medical syndicated talk shows right now. And the Ask the Doctor network continues to grow. We're in lots of big cities all over the country. And I do want to mention for 2025, we expanded the Lange Eye Institute, both sides. We expanded a new wing. We added a lot of new equipment to the Lange Eye Institute. So it was already a state-of-the-art eye care clinic, but it's even more of a state-of-the-art eye care clinic. We added the luminous OptiLight and OptiLift to the Lange Eye Institute, and Dr. Summerton and I are both the doctors that do these procedures at the Lange Eye Institute. So now we're able to take dry eye treatment to the next level. I also want to thank Moffitt's Cancer Center for curing my brother's melanoma. That was a big relief. We had launched a few new supplements through Fortify Vitamins in 2025. We launched the popular creatine MyH&B vitamin D supplement. That's something everybody should put on their New Year's resolution to help build muscle and help with cognitive issues. Also, we developed the new next gen organic blue green superfood, where we added the beta via and we added a few other things to refine it. We finished the research and development for our Fortify Fit meal that's coming out, I'm hoping, in February, to help us maintain our weight, lose our weight naturally, build muscle while losing fat. We started some research and development on a gummy or a chocolate melt, and the gummy might be a chocolate gummy, raspberry gummy, who knows? It might be a chocolate square, but it's going to be developed as a snack, a healthy snack to curb our appetite with 0 carbs and 0 sugar and only 10 calories. And we're also working on a new kids gummy based on some great studies with lutein, zeaxanthin, and astaxanthin. So that's some things coming down the pike. But Dr. Summerton, I want to expand just briefly about the 2 new devices that we put in, that the OptiLight and OptiLift. This is really adding a new segment of care that's not being offered in the villages or the area for our patients, isn't it?
Right, and it is something we talk about frequently because it happens to many people, is dry eye. And we're always looking for ways to help our patients. And every modality works a little bit different, enhances the other. And so we were looking for something to expand upon what we were already doing. And these 2 devices really take handling dry eye to the next level. If you've tried everything or thought you've tried everything, this is something that you probably haven't heard of. Or if you had tried it, patients search us out to actually, because it worked for them several years ago and they're looking to do it again. The IPL, intense pulse light, that uses what we know, what we call photobiology these days, of how effective light is at healing. And there's 4 procedures. They only take about 15 minutes each. You do it 1 to 2 weeks apart, using light and using that energy to open up those oil glands in your lids that we have such a hard time with getting that oil into the tear film. So your tears are just evaporating so quickly. That's what puzzles most people about dry eye. They complain of their eyes watering, and they look at us confused often when we say, well, that's a symptom of dry eye. And it's because you're not getting that oil into your tear film. So every time you blink, your tears are evaporating way too fast. You should have about 16 to 18 seconds. If you don't have that oil, then you also don't see clearly, and your brain says, make more tears, and you get that watering. So, this is a way of getting to that root cause of opening up those glands with that new technology.
Right. So OptiLight and OptiLift are both offered at the Lange Eye Institute. You can set up an appointment to see Dr. Susan Summerton or myself, Dr. Michael Lang, to see if you're a candidate for OptiLight and OptiLift. Remember, like Dr. Summerton said, if you have dry eyes and you've tried everything, artificial tears, hot compresses, punctal plugs, every drop under the planet, you've tried different procedures and nothing has really helped, might be time to look into intense pulse light therapy. And luminous OptiLight is the only one FDA approved for dry eye treatment. So it is offered at the Lange Eye Institute. And then We have the OptiLift. The OptiLift is for people that have these lower lid laxity issues, baggy lower eyelids, eyes that don't close all the way, lower lid ectropion, eyelids that turn out, and also dry eye, meibomian gland dysfunction. This also works at helping to open the meibomian glands, increase the muscle integrity, the ligaments and the tendons and the collagen production all around the eye. So not only is it a functional procedure, it is also somewhat of an aesthetic procedure. When you combine OptiLight with OptiLift, it's the double whammy of fighting against dry eye and saggy, baggy eyelids. So think about it, Lange Eye Institute. You can learn more if you go to our website at langeyecare.com or drmichaellang.com. So either langeyecare.com or drmichaellang.com. There is a section on OptiLight and OptiLift. Also, I'm going to give you the phone number for the Lange Eye Institute. I'll give it to you twice, so get a pen or paper. And it is 352-753-4014. That is 352-753-4014. Also, learn more about the supplements that we have to offer at fortify.com. That's FORTIFEYE, fortify.com. That's the Fortify Vitamin Company, based on the right science, right ingredients, right for you philosophy or motto. Also, today is the 27th of December. I will be at the Fortify Nutrition Center today. The last time I'll be there this year. So right there on McMullen Booth Road in the Bayside Bridge Plaza. Come on out. I'll be there from 1 to 3 at the Fortify Nutrition Center. We're going to talk about why an eye exam is so important, why it's important to have your eyes dilated, and why an optomap is so important, not only for eye health, but for overall health in just a minute. But we're going to go to the first caller. Probably everybody knows who this is, Steve in Clearwater. Good morning, Steve.
Yeah, well, remember last week you were talking about people who have problems on long plane flights with thrombosis?
Right.
Well, I got to thinking about it for a minute. I would think that there's another group of people that have far worse problems with that, and that's long-distance truck drivers. And the reason I think so is because people who travel might do it 3-4 times a year at the most. Truck drivers do it every day. People who are on airplanes can get up and move around. A truck driver is locked in that seat for sometimes 7-8 hours going straight. Not only that, but his left leg is constantly on the accelerator, so the gastrocnemius muscle and the muscles in the thigh are always slightly contracted, which would also reduce circulation. So I'm thinking that maybe just truck drivers and cab drivers and people who drive actually have much higher risk than people on plane flights.
And
do you think that could be true, or do you think that's a bunch of BS?
No, absolutely. I think you're correct. And I think that's why, you got to get out for anybody driving for long periods of time, get out of the car, stop at the rest area. When we drive to New Orleans, we always stop at the rest area, stop and stretch.
Right.
Because if you're staying in one position for a long period of time and not moving, like I said, we talked about 15 minutes last week about the increased risk of, thrombosis and all sorts of clotting disorders and clotting problems. And then, of course, that increases your risk of death. So it's a good idea for all the truck drivers that are listening out there to move around, stretch a little bit, get out, walk around for every few, the studies indicate you got to be driving really, the worst is over 8 hours though. Under 4 hours is okay. So most people have to stop at 5 hours to refuel their car. So if it's 8 hours or more, it becomes a big problem. Those are international flights. Those are the ones that are the biggest problems.
Well, another thing too is that when you're in a car or you're driving, your leg is in the bent position.
Right.
Now, there's common aneurysms. A lot of people, Dick Cheney had these, where people get little aneurysms at the knee. It's because if you take a straw and bend it, okay, your arteries going down through the leg. What happens when you take a straw and bend it? It forms a crack in the middle, which is thinner, the lumen through the straw. It pinches it. And so that's another thing that would add to it. And the third thing is, have you ever looked at animals when they sit? they don't have pressure on their femoral arteries, or their what's equivalent to their femoral arteries. They, even when animals, look at your dog and look at your cat, when they sit, their all their weight is going into their bottoms of their feet, whereas with us it's going into the thighs and our butts.
Right.
It's a completely different thing. And one more real quick thing, you know that Dr. Summerton was just talking about the getting the oil and the water to mix in the eye fluid. You know what I'm talking about?
Yep.
What if you took an emulsifier like lecithin in your diet? Would that make the water, instead of the water having little beads of oil in it, it would homogenize the fluid in the eye so that it would be more an even substance instead of little beadlets of oil in that fluid?
You know, I'm going to let Dr. Summerton address that because I have no idea. Maybe Dr. Summerton does.
Yeah, I haven't really researched or seen research on the lecithin, and I think it's not that they're not mixing together, it's that they're simply not releasing that oil into the tear film, because we can look at the lids and actually see those meibomian glands just clogged. And even when we're testing, we push on their lid a little bit to see if even pressure brings it out. And a lot of times nothing happens. So we need to actually support getting the oil into the glands with like the omega-3, and then making sure that it can express out.
Okay.
Yep. So omega-3 is not only good for meibomian gland dysfunction and dry eye, but omega-3 is probably also good for the truck drivers and everybody flying for long flights to decrease the chance of having, these clotting problems. And, we even talked about baby aspirin, but baby aspirin, not high dosage of aspirin, benefiting how the two baby aspirin combined with omega-3 increases the resolvins and the protectins in the omega-3, making it even work more effectively. But also, talking with your doctor regarding this is a very good idea instead of just willy-nilly doing it yourself. So, Steve, thanks a lot. I appreciate your call, and happy New Year, Steve.
I think so, and I think you're in for a tremendous year this year at Lange Eye Center.
Well, I hope so.
Okay.
You take care.
Okay.
Thank you for all your calls this year, Steve.
Right. He's persistent. So, Dr. Summerton, we don't talk about this enough on this program, and we're going to expand on why an eye exam is really important. I mean, for any reason, I mean, glaucoma is the sneak thief of your sight. You have no symptoms until it's too late. So if for any reason, checking the pressure and analyzing the optic nerve, that should be reason enough. But when we look at the peripheral retina, we look at the tiny arteries and the blood vessels and the nerves, the retina with certain technology, we can see a lot of other things going on in the eye that might not only be vision saving, but ultimately could be life saving. Can you expand on why an eye exam is so important?
It is, and that could be one of your New Year's resolutions, is to get out there and get ahead of the problems and schedule that annual comprehensive eye exam. But we also stress part of that comprehensive is dilating the eyes and getting a baseline retinal imaging test, because you can come in and we can check your vision. You could have 20/20 vision. You may or may not need not glasses for that, but there definitely could be other things going on. And when we open up the pupil, that's like opening up the window so that we can take a direct look inside your eye. I mean, it's really an easy way. We don't have to cut anything. We don't need any fancy MRI scans or anything like that. Simply by dilating your pupil and also getting a nice retinal image with a couple flashes of light, some bright lights, we can see the nerve that goes from your eye to your brain. We can see those blood vessels that come from your brain through your nerve into your eye. And we're looking for any signs of diabetic retinopathy, hypertensive retinopathy, any bleeding that could have, you've had a sign of a stroke in your eye, any swelling of that nerve. That nerve is the pathway from your eye to your brain. That can tell us many things. We're looking for any sign of inflammation. We know inflammation is the cause of most disease. We're checking your pressure to make sure there's no sign of glaucoma. We're also checking, this came up for me last week, where we're checking what we call the angles, just basically the structure of your eye, looking to see if you have a open angle, a narrow angle, or worse, a closed angle. And this is just how your eye is shaped. If you have a narrow angle, you're very high risk for angle closure glaucoma, which you don't want to get because that can be very painful and you can lose vision a lot faster that way. And we have to look at the eye directly to be able to see that size of the angle. And there is a simple procedure that we can do to prevent it from ever closing. Now, fortunately, it is more rare, but it's definitely one thing that you're not going to pick up unless you get an eye exam there. And so many things, even dry eye, if we start to see those glands not working effectively, we can do the omega-3s, we can do the warm compresses 3 times a week. We can remind you, make sure you're off that screen, get that 20/20 rule going, and make sure every 20 minutes you take a 20-second break to look greater than 20 feet away. We can make sure you're in those blue light protecting glasses. It's going to protect your macula. It's going to protect you from the extra strain from looking at the screen all day. Make sure you're getting those leafy greens in your vegetables. Those ingredients from the leafy greens and the orange vegetables, lutein, zeaxanthin, those are stored in your macula. We're making sure your macula is nicely pigmented. The more pigmentation you have, the less chance of macular degeneration. So there's many things we can do proactively by evaluating your eye and making those recommendations so you can get ahead of those problems.
Absolutely. And you brought up blocking the blue light. So there's a couple of ways we can do that. We can eat foods, all right? Things like orange bell peppers because of the zeaxanthin, goji berries because of the zeaxanthin, dark green leafy vegetables because of the lutein. And these carotenoids impregnate into the macula, increasing what we call macular pigment density, thus protecting us from that harmful blue light from the digital world that we live in, all right? But you can also take Fortify Focus or Fortify Focus and Brain. It's a little black and reddish gel cap. I've been taking ever since we developed it, and that increases macular pigment density as well. It also helps with cognitive ability. It helps reduce oxidative stress and inflammation in the brain and the retina. So, think about Fortify Focus or Fortify Focus and Brain, adding that to your anti-aging regimen to protect your eyes against this damaging blue light and much more. And you can check that out at fortify.com. But also investing in when you buy glasses, especially if you're on the computer a lot and the iPhone a lot, something that has either blue light defense or blue light shield. Those are the two I like the best, blue light defense and blue light shield. And the reason for that is the blue blocking properties are inside the monomer. It's not a coating like most of these companies. They put a coating on, and you can clean that coating off. So blue light defense or blue light shield you can get almost exclusively through the Lange Eye Institute, and it's based on the Dr. Funk studies. And this is proving that 411 nanometers is one of the most harmful frequencies of light, blue light, to damage the retina. And the blue light defense and blue light shield is blocking from 400 to 420 nanometers almost exclusively. Covering that 411 nanometers. And then it lets some of the other blue light through so it doesn't interfere with your circadian rhythm and your sleep. So think about that, making your glasses out of blue light defense and blue light shield. Also, I'm going to talk briefly about something we've never spoke about on this show and nobody's ever spoken about in the entirety of the world. This is the first time it's been introduced in the world, really. So it's some new lenses that are really very cool. Some new lenses for driving. So Steve brought up the whole concept of, truck drivers maybe increasing the risk, like people that are in a plane a lot, of having problems with clots. And therefore, omega-3 is not a bad idea and getting up and exercise and things like that. But if you're driving a lot, especially doing a lot of night driving, all right, let's say you're under 45 years of age, you don't need a bifocal or progressive lens, and you do a lot of driving, and a lot of it's night driving. There's a new lens that you can get exclusively right now. It's just been introduced at the Lange Eye Institute, and it's called Eye Clear Drive. Eye Clear Drive, and it does increase night vision. So this might be something good for the people that are out there racing cars and doing night racing. So there is a specific night vision zone in the glasses that you only see at night through because your pupils dilate. So you get into this, and this zone actually compensates for the effects of night myopia. So this lens is pupil dependent. If you're using some of these new drops that constrict your pupil to see up close, it's not going to work as well. So it's called Eye Clear Drive, and it's going to increase your night vision, and it does work. My wife, Tammy, had a pair made. She loves them, and they make it in a progressive lens called Zoll, Zoul. I think I could rename it. I think, Dr. Summit, we could both figure out a better name than Zoll Drive. So Zoul Drive is a progressive lens that has an amazing channel. A lot of you that wear progressive lenses, you know the channel can be very narrow. And if you're driving a lot, you don't want a narrow channel. You want to be able to look out your rear view mirror, at your CD player or your digital dash. Nobody has a CD player anymore. And the instrument cluster. And so the Zoll Drive is the progressive lens for driving. The Eye Clear Drive is the one that's single vision. It's exclusively through the Lange Eye Institute right now in Florida. It might be offered in a few other places. So come on by the Lange Eye Institute and see what we have. And Dr. Summerton, it's all about technology. And that's what we like to offer at the Lange Eye Institute. The latest in technological advancements, whether it's optical, nutritional, surgical intervention. We really try to stay on top of these latest advancements, don't we?
It is, and we want to be proactive. We know the sooner, if there is a problem, we find it, the easier it is to take care of. And the new technology allows us to kind of get ahead of the game and see things before they get worse. Now, we can handle it at all stages, but it's the sooner the better.
Yep, I agree. And we're getting loaded up, so we're going to go take some calls. We're going to go to Hugh in Ocala first. Hugh, good morning. Welcome to the program.
Yes, thank you. Good morning. See, on a regular eye exam, can that reveal if you have high blood pressure?
Oftentimes, absolutely. We look for some telltale signs. We look at the artery and vein ratio, how large the vein is to the artery. We look where the arteries and the veins cross, all right? We look to make sure there's no bleeding in the nerve fiber layer, which causes a flame-shaped hemorrhage. We obviously look at the optic nerve to make sure there's no inflammation. So, yes, we can oftentimes detect hypertensive changes before you have symptoms, and oftentimes even before your primary care physician can. So that's another great reason, to have a comprehensive eye examination. And this is where something called the optomap really comes into play, because you got to be dilated, at least at your initial examination, but you don't want to have somebody shining a bright light in your eye for, 5 or 10 minutes. The optomap is one little quick flash, and then we pull up the back of your eye. It shows us the entire back of the eye, and we go to different levels of the retina with this. It's kind of like an MRI, if you will. We go through different layers of the retina to see what's going on. And from a vascular standpoint, the optomap is incredibly active at picking up things like hypertensive and diabetic retinopathy. And then we can take it to the next level. We have new technology called OCT angiography that actually looks at the blood vessels underneath your retina, also for irregular vascular problems that can be related to, a vascular system as well.
Okay, thank you, and Happy New Year.
All right. Happy New Year to you as well, Hugh. All right. You're listening to Ask the Doctors. This is our final show. Not the final show, I hope, but the final show for 2025. And I also want to take this opportunity to thank the gang at Salem Media for making 2025 great. AJ's done a bang-up job. Of course, Joe's done a good job. And Venetia, who I call Vegas, has done a great job. So I appreciate y'all's hard work. And, of course, Dr. Summerton. The show wouldn't be the same without Dr. Summerton. All right. We're getting ready to go back to the phones. If you got a question, give us a call at 813-282-8283. That's 813-282-8283. Before we take the next call, I just want to mention there's a supplement we talk about a lot on this program. And it's one of the most studied supplements on the planet, if not the most studied supplement on the planet. I think the most studied supplement on the planet is omega-3, and the second most studied supplement on the planet is creatine. And we'll expand on both of those as being something you need to be doing for your New Year's resolution. But I just want to quickly expand on why Dr. Summerton and I recommend a good re-esterified triglyceride form omega-3 to our patients, and why we talk a lot about on this radio show. There's some interesting studies that have just occurred over the last few years that indicate that the top 20% of plasma omega-3, these are people that do have heart conditions, and if you have the top 20% of omega-3 in your blood, it reduces the chance of death by 50% compared to the lowest 20% of patients. So, if you're eating fish or taking a good omega-3 fish oil and you have heart conditions, could reduce the chance of you dying significantly. Also, the reduced risk of all causes of mortality, if your omega-3 is slightly high in your blood, is 10% reduced risk. The risk of a CV, a cerebral vascular incident, if your omega-3 is elevated, is 18%. Their decreased risk of mortality. All right. The decreased risk of a heart attack is 23%. A fatal heart attack is 35%. The risk of sudden cardiac death is 33%. The risk of hospitalization from angina is 25% less. And now here's one of the newest studies in the Journal of American Heart Association shows the decrease of risk of atrial fibrillation is significant if the levels of omega-3 are elevated. Now, the whole key is consistency, quality, and absorption. Most of the omega-3 that you buy over the counter, and we preach this, and my recommendation is probably you should throw it in the trash. I said most of it. There's some good quality brands you can buy over the counter, but it has to say on the bottle either TG form or RTG form omega-3. And you need a minimum of 1,000 milligrams combined EPA and DHA, a minimum of that, and preferably more like 1,600 to 2,400 milligrams to get the true therapeutic effects. But the studies are pretty conclusive now that omega-3 is good for you. Not to mention it's good for rehabilitation after sporting events. It helps you recover faster. You know, it's good for the dry eye. It's good for your retina. It's good for your joints, your hair, your skin, your nails. So omega-3 is very important. But Dr. Summerton, we do preach this. All omega-3s are not created equal, are they?
Right. And it is so important that you might have to spend just a little bit of extra money so that you're actually not wasting your money on the bad quality and even worse, becoming bad for you. And if you're questioning to yourself whether you really need it or not, there was a big study across 42 countries, and they basically found that 76% of the global population aren't meeting those recommended intakes of what we call the EPA and the DHA from omega-3. And omega-3 is by name an essential fatty acid. And so even us, we do try our best to get that food in our diet that supplies the omega-3, the grass-fed meat and the seafood. But unfortunately, it just is really hard to get the recommended amount to keep you healthy these days and optimize your health. So that's where the supplementation comes into play. And we want to make sure that you're choosing the kind that is going to absorb. And that triglyceride form, the TG form that we talk about all the time, that's the natural form that's found in fish. So you are absorbing it. You're not going to get that fishy burp. If you're burping it up, it means you're not absorbing it. So it should be like when you eat a piece of fish that you're not burping it back up. And so we want to make sure that the money you're spending on it, you're getting the health benefits that we need. We need a good dosage to affect the dry eye. We need a good dosage to affect good brain health. And we need a good dosage to affect good heart health. And we want you to get those benefits. And that's why we're constantly going over the quality. Plus, we want to make sure there's no contaminants in it. People know about the mercury and the toxins that can be found in the fish. So the way fish oil is processed affects how you process it. So we want to make sure you're getting the absorption, it's not contaminated, it's not been exposed to light or heat, If it's sat outside, especially in somewhere like Florida, parking lot, and reached extensive temperatures, it's going to oxidize and then it's going to be bad for you. So you have to be careful about what kind you get for fish oil.
Right. So certainly check out and see what you think about Fortify Super Omega and Fortify Super Omega 3 Max. And look at all the research and the science at fortify.com. That's Fortifeye. I'm going to give you the phone number, then we're going to the cause. The phone number for Fortify Vitamins is 866 503 9746. That's 866 503 9746. I know we lost a couple of people on hold. We'll take you if you call right back. But let's go back to the phones. Taylor in Indiana has been waiting patiently. Taylor, good morning and almost Happy New Year.
Hey, good morning, Dr. Mike, and Happy New Year to you and to you as well, Dr. Summerton. I'm glad you both hammered on fish oil, and specifically omega-3. I could speak from experience that has been something that has changed my routine, especially over the last year or so. And incorporating that specifically from Fortify into my routine. So that's been super helpful, and I've been seeing the benefits throughout. My one question was, going into 2026, I'm trying to increase my energy and performance. Is there something that Fortify offers that would be a ideal performance bundle, or is there something that you would include in that if I'm trying to kind of increase my own, not just my working out, but in day-to-day life and business and things like that, to kind of, hone in on maybe increasing that performance in that way?
Yeah, absolutely. I think number one is our Fortify Fit Pro. Okay, so Fortify Fit Pro, we recommend it to everybody at any age. I mean, after about age 13 and up. I mean, my youngest daughter, used the original Fortify Fit when she was, 11, 12 years of age. And she became a very competitive volleyball player, and she's excelling in college now. So Fortify Fit Pro is something anybody wanting to build muscle, strength, endurance at any age, and help lower homocysteine, increase cognitive efficiency, reduce brain fog. Fortify Fit Pro, we've taken all of the ingredients. We've taken whey protein isolate, grass-fed whey protein isolate for the muscle, grass-fed collagen protein for the ligaments, tendons, joints, hair, skin, and nails. We've taken Pure creatine, the best creatine in the world for power and brain and muscle. We've taken MyHMB, which is just incredible, amazing science because it stimulates protein synthesis. It reduces the breakdown of muscle. It also is great for weight management. So it helps you build muscle while losing fat. Remember, this is the supplement that Tony, who called in and was a guest on the show not too long ago, Tony used to help lose 250 pounds and build muscle. We'll have to have him on for another show coming up in the near future because he's really changing even more. So the MyHMB, the creatine, the whey protein, the collagen protein, the L-citrulline, which is a vasodilator amino acid, bringing these nutrients to every part of the body. Beta anhydrous, which is amazing because it lowers homocysteine, increases power and muscle tone. And then there's no caffeinated stimulants in there. We use peak ATP, that's adenosine triphosphate, to give you clean energy. So an 80-year-old athlete can use this without being concerned about it triggering atrial fibrillation and stroking out in the gym. And then we added vitamin D and some other things to it. So Fortify Fit Pro is my number one recommendation for energy, strength, endurance. And then if you're a vegan or you just don't want to have whey protein, then it would be our vegan protein. We have 3 different flavors combined with our new Pure creatine HMB vitamin D. And Dr. Summerton, you had taken a break from whey protein and you've been using the vegan protein combined with the creatine. And how's that been going?
It is. I really enjoy the salted caramel mocha flavor, and that's really what I have been having most mornings. I think it's a great just wake up drink and get me started before I work out and even after I work out. And I mix it with what you already talked about, the MyHMB and creatine supplement. And I also put a scoop of the collagen in there as well. And if you want a testimony to the taste, I have been blessed to be babysitting my 3-year-old granddaughter this week, and she watches me drink it, and she calls my little sippy cup my little shaker there. And every time I make it, she wants to try it too, and she loves the flavor as well. And she's 3 years old. So it is testimony that is a nice flavor as well.
And with both of these, Taylor, whether it's the Fortify Fit Pro versus the combination of the vegan protein and the Creapure creatine, we actually have a bundle on the site where we take the Rejuvenate, which is the amazing supplement, powdered supplement for skin, hair, and nails and joints, where we combine the Rejuvenate, your choice of vegan protein, and the new Creapure creatine H and B vitamin D. And I think it's called like the the Vitality Pack or something. Go on to bundles and you'll see it. And they give you a really good deal on that. But both of these, the reason they work, they remove the brakes on muscle growth, something called myostatin. Myostatin is a protein that actually stops muscle growth. And so it's removing these brakes on the myostatin. It's blocking or suppressing the myostatin. And we're providing the raw materials for muscle repair and recovery, which supports strength, endurance, performance, literally at any age. And as we get older, a lot of, I should say, seasoned listeners listen to Ask the Doctor, and they're developing sarcopenia. That's muscle wasting. When we hit 50 or 60, we start to lose muscle tone. And then also, if you're taking some of these GLP-1 receptor drugs, you can lose muscle tone even faster. So both of these options will protect against the sarcopenia and keep you strong as you're aging. The whole key, this show is talking about, building muscle strength and health while losing fat.
Yeah, absolutely. Thanks so much for the advice. I'm heading over to the site shortly, so I appreciate that. And then it's also kind of cool to learn about the myostatin piece and kind of your own body putting the brakes on muscle growth too, which is something, I'm not overly familiar with. So it's nice to hear a little bit about that. I'm sure it's something you could probably talk about for days and days and days, but it's nice to see that Fortify has products that can kind of fit the bill to help out with that. So thank you so much for taking my call, and I hope you guys have a happy new year.
Okay, Taylor, happy new year to you. And thanks for being a caller.
Happy New Year, Taylor. And I did want to bring up something we talked about, the muscle, and we're not bringing up the mental part of it. And we know that working out, even day to day, you need that cognitive focus and that mental energy. So that's where the Fortify Focus and Brain could also enhance better performance. When you get improved focus and brain metabolism, that's going to translate into better performance.
Absolutely. And we're gonna talk about something else that can help reduce stress too. Mental stress, physical stress, steps, walking. Everybody's wearing a watch that records their steps these days. And I think there's some pretty interesting research that's come out relatively recently that talks about just walking, not running, not sprinting, just getting extra steps during the day and increasing your when I put it in the steam room, it opens up my lungs and I feel better. If I'm getting a little congested, if I feel like I'm coming down with something, it seems like it knocks it out. And after I travel a lot of times, not only am I taking the new time release vitamin C that Fortify has, when I travel, I take one every 8 hours. And I think that's
Oh,
been reducing me from getting sick. But I try to get in a steam room with eucalyptus oil and or peppermint oil, and it's reduced my rate of sickness after traveling on a plane.
where do you get the essential with the peppermint oil, and how much do you put in? What do you just vaporize it in the steamer or something
Yeah,
like this?
I mean, it's not an exact science. I just take the cap off and just shake it on the floor where the steam hits it. And,
Oh,
or you can put it
great.
in a bowl, right? And hot water and put your face over it with a cover over the bowl, a towel. Just don't scald your
Yeah.
face and just mix, put about 5, 10, 15 drops in the water and stir it up. And then you'll inhale it. And I don't think there's anything negative about it. And I know from a
Okay.
standpoint, and I've been doing this for, 10 years, and it does make me
Wow.
feel better.
Yeah, that sounds great. And what is the source of it? Is there a source of a quality oil?
Yeah,
Or
I mean,
what?
I go shopping at Sprouts and Whole Foods all the time, and they got a
Oh,
whole
okay,
essential oil
gotcha.
section there. So once
Yeah.
again, I'm not endorsing essential oils. I'm pretty much a moron when it comes to essential oils, but I
Oh,
think it's beneficial. And sometimes I actually put it in the hot tub when I'm in the jacuzzi and put a few of it in there too, and maybe that
oh,
helps as well. So there's definitely some
great.
science. There's definite science
Yeah.
on aromatherapy. There definitely is. I'm just not up on it. Okay.
Okay. Thank you very much, Dr. Lang. Have a wonderful day.
All right. You have a happy new year. Okay. Dr. Summerton, are you back?
I am back.
She's back. All right. So I was going to let you chime in briefly about steps and longevity, steps and reduction in stress. I think there's some pretty interesting research, and you really brought it to my attention. So you're going to expand on it.
It is. And something we always talk about is movement. And people question, well, how much we all have these trackers that we can on our phone or our rings or our watches to how many steps we're actually taking per day. And there was another study that just came out that said as few as just 2,517 steps per day yields an 8% reduction in all-cause mortality, and that's compared to what most people do around 2000 and under. So if you just make a little bit of extra effort to put in another 517 steps a day, you're going to have a significant effect. Now, it also, the more you did from that, kind of optimized at about 8,700 steps today. And that corresponds to a 60% lower risk of death. And there's not much, one simple thing, such as taking that many steps, can have that beneficial effect. So it could be a New Year's resolution for you to get at least 8,763 steps per day, something simple, whether it's just going for a walk for 20 minutes a day, preferably after you eat, a great time to take a walk outside. And we're talking about another study. When is a great time to take a walk? Is if you're in a bad mood. Another study proved that you can walk out a bad mood faster than you can kind of talk it out, just because that movement that you're doing has this nice hormone effect on you that raises the serotonin in your body that makes you feel better and lowers the cortisol in your body. That's that stress hormone. And so it's a great time just to switch your mood, or even if you have a decision to make, it's a great time to take a walk outside, let that brain and those hormones optimize and get you in a better mood and make those decisions that are important to make and solve problems while you're walking too.
That's amazing. 8,763 steps per day corresponds to a 60% lower risk of death. So, start walking and at least get, what is it, 2,517 steps, just 500 steps
Yes.
over the average. And that's going to extend by 8%. So we got to start walking for the new year. Also, I just want to recap quickly about resistance training. We talked about it last week. Resistance training decreases mortality from all causes and protects against dementia and Alzheimer's. So there's a risk reduction of 27% with just 60 minutes a week of resistance exercise. That's hardly nothing. So the Journal of American Medical Directors Association also showed you could reduce the risk of dementia by 69% if you exercised for greater than 140 minutes a week. So exercise not only builds muscle, reduces the chance of death, premature death, and reduces dementia. Also, studies have come out showing that 2 to 5 servings of fruits and vegetables a day decreases the risk of all types of causes by 13%. That's 2 to 5 servings. But if you bump it to 10 servings, it reduces the risk of heart disease by 28%, stroke 33%, and premature death by 31%. So now we know for the new year, you got to get out and walk more. You got to do more resistance training. You got to eat more fruits and vegetables. Take a good omega-3 fish oil like Fortify Super Omega, and maybe add either the the Fortify Strength and Vitality Bundle, Fortify Strength and Vitality Bundle, or the Fortify Fit Pro to your regimen. And like I said, for the new year, we all want to live longer and be healthier and happier, lose fat and build muscle, and we want to thrive and not just survive. And so, Dr. Summerton, I want to thank you for hosting the last show of the year. And you got about 15 seconds to tell everybody bye for the year.
Thank you, listeners, for all the great year of 2025. Wishing you a happy, healthy, successful 2026.
And I am Dr. Michael Lange, helping keep America fit and healthy. I want to wish everybody a happy and healthy New Year's. Go out and get those steps today. Don't wait till tomorrow. Start your New Year's resolutions today. I'm out of here. Have a great day. God bless you.